You know, one of the great things about Polk County is we are the host to some of the finest medical and health services around. And here in the studio joining us today are two of those services with Cornerstone Hospice and the Moffitt Cancer Center. Joining us is Venessa Rivera-Colon. She is the program manager for Empower at the Moffitt Cancer Center in Tampa. Also joining us is Vivian Norrell.
Good morning.
She is a registered nurse with the Cornerstone Hospice. And joining us as well is Jeanette Palencia. She is the outreach coordinator for the Moffitt Cancer Center there in Tampa. Now, Vivian, I wanted to ask you a little bit about Cornerstone Hospice. For those who aren't familiar with the program, what kind of services do you offer?
Yes, thank you. Well, Cornerstone Hospice is a non-for-profit organization, and we've been in the area in Polk County for almost 9 years now. But we are the biggest hospice right now covering Central Florida with 7 counties. And what we do, we serve the community on patients who have a self-limiting, limiting illness. We take care of these patients as well as the families. We have an interdisciplinary team that each patient is going to have, which includes nurses, chaplains, social workers, home health, and each case is different. So what we do, we look for the needs of that family and the patients, and then we go from there. The important thing is to give quality of care and quality of life for those patients.
Yeah. Now, your services, they're quite broad. As far as the locations, is it just here in Polk County? Do you guys stretch out even further than that?
Yes, we cover, Cornerstone started in Tavares in 1984, and since then we cover Lake and Sumter, Orange, Osceola, Polk, Highlands, and Hardy. So it's a big company.
Yeah.
It's a great organization.
And such a terrific service that you guys provide. And
yes, we do.
And
Thank
of course,
you.
now teaming up with Moffitt Cancer Center with some of your programs. Vanessa, can you tell us a little bit about how what the Moffitt Cancer Center is, first of all?
Definitely. Well, thank you again for having us today. The Moffitt Cancer Center, we're a National Cancer Institute comprehensive cancer center. So we look at the whole spectrum of cancer. We're for the whole state of Florida, and we're celebrating our 26th year this year. And it really is from the very beginning of screening to treatment to follow-up, survivorship. We have the latest treatments. We have researchers as well who are constantly working on trying to find a cure for cancer. Our particular department is Empower. Our focus is really to get to people before they have a diagnosis. So we focus on screening, educating the community on how to reduce the risk through healthy lifestyles. And our focus, we have a very multicultural focus. So we look at different communities. Our staff speak English, Spanish, and Creole, and it's all through the Tampa Bay area we cover. And we're looking at some national efforts as well. So Moffitt is really for Florida, internationally, nationally, but we provide the services to the community.
That's terrific. Now, as far as the cancer goes, obviously there are such a wide variety of cancers. Are there specific ones that you focus on? That you have specialized departments in, or what kind of goes on there at Moffitt Cancer Center?
We cover all of the cancer types, and we have specialists. So you have different clinics you have that are very specific to breast, to blood cancers, to prostate. So we have I have to say, we have the best doctors. They're specialists. They're known throughout the nation for the treatment that they provide. So if somebody comes to us, it's a very specialized care. It's to the patient. Back a few years back, a lot of the treatments were very similar. Now it's a very specialized treatment based on the needs of the patient.
Excellent. Jeanette, you are the outreach coordinator there. Tell us a little bit about some of the efforts that you're going through to reach out to the communities, and maybe even kind of prelude into what we're about to talk about, the Yo Me Cuido.
Yo Me Cuido is a program for the Hispanic women, and it's a program dedicated to them so that they could come and do their services and do their screenings on time, not after that they get a diagnosis. We do an education. We go to different churches. We go to different locations where we get invited, where we have a group of women, over 25 women. We could go to, we've been to restaurants, we've been to beauty shops. We're just open, and it's not a closed in. Just where we could find a group of women, we're there for them and to teach them on prevention and healthy lifestyles.
Excellent. Now, so why is Yeoman Cuido important for the Latino community?
Recently, it actually came out in the news that heart disease was the #1 killer for Hispanics. Well, cancer is now the #1 killer for Hispanics. And what we're seeing is there's some cultural challenges that we're seeing as far as, you know, oftentimes our ladies tend to put themselves first, as in many, many cultures. So they're taking care of the family, they're taking care of the children, and they're not going for their screenings. Or they find out that something's abnormal, they have an abnormal result that they may suspect that it's some type of cancer, breast cancer, and they're not following up. So that's really what we're trying to do, is send the message that we need to take care of ourselves. And that's what Yo Me Cuido means. I do take care of myself. We need to take care of ourselves. We need to take our health into our hands. We need to be empowered. And that's the importance. Let's get there on time. Let's not wait until the later stages of diagnosis.
So was that kind of the motivation behind starting this program? You realized that, hey, this has become a much larger issue than it has in the past. I mean, is that something that you had noticed?
That was definitely the motivator behind it. When we had ladies coming into our offices and they had results of abnormal results, and now it was at a much later stage. We would run into people in the community who had not gotten screenings on time. And that was truly the motivator. We're really trying to save lives, and it's really the process is, you know, get those screenings, get the mammograms, you know, eat healthy, do a little bit of exercise. The formula is not very complicated, but when we have challenges with access to health care, language barriers, we don't know exactly where to go, it becomes a bigger issue. So we really try to navigate women to get to that next step, you know, get your screenings, do your follow-up on a timely basis.
Well, along those lines, how do the, I mean, obviously this is an educational, you know, this is an education reach out to reach, you know, these communities. How do the workshops work? How does the education actually function? Do they meet somewhere? Is it traveling?
Well, right now we're traveling Hillsborough County, Polk County, Pasco, and Pinellas. And they come to we usually get a leader. A church leader might contact us. I want to have Yo Me Cuido workshop at our church. And at this time, we ask them, you know, we do registration. We ask them to put a group together. We confirm the date. And then they get flyers and they start spreading the word around. There have been times that we have 65, 70 people at one of our workshops.
Wow.
Yes, but the thing with Yo Me Cuido is that we don't come with a message and then we leave you there. We'll do the follow-up. If you're a woman of 40 and older, we will go, we will when you register, we will know when is your last mammogram. Are you having problems getting a mammogram? Do you have insurance? You don't have insurance? Because if they don't have insurance, we'll hook them up to different resources that we have in our community. And then I will get on the phone and call them, did you have your mammogram? Oh no, I forgot. Okay, thank you for reminding me. And then when we do that, they are so appreciative that we do take the time out to be there for them and to remind them that they do have to take care of themselves.
How long has the Yo Me Cuido program been actually in operation?
It was born July of 2011, and but Jeanette's been doing this for over 15 years in the community. But it really, we gave it a name at that point, and it grew. It's been like wildfire. It's been very dynamic. The community's ready, and I really wanted to thank Hospice, Cornerstone Hospice, for helping us open the doors here in Polk County. It's just been a tremendous partnership, and we're extremely appreciative. But that's when it started, and they've reached over 1,000 women since July of 2011. We also had a campaign on television, and we had almost 4 million viewers. And there were just small segments of just reminding women, get your screenings, get your checkups.
That's terrific. Are you planning on, obviously, like you said, Jeanette has been, doing this for years now, and now you've actually labeled it. You've given it. You're seeing this success just start rolling. Are you planning on expanding the program? I mean, what's the future for Cuido?
So the future is we will be in DeSoto County. We're excited about that in November, and we've had requests from other states actually to take the program there. So our goal is to really have a national effort. It started here in this area, but to have a national effort to encourage women and also men. And we keep saying women, but men to take care of their health. So we're looking at some possibilities in Pennsylvania and in Texas as well to bring the program. And what we're doing is, because it's Miriam and Jeanette, our outreach workers working on the project, is to train others to deliver that message to then empower their communities to get the ladies moving there as well.
That's terrific. That is terrific. As far as a parting message for our viewers, what would you say to encourage them to either get in touch with you guys or local, whatever it takes to get involved with getting their screenings and things? What kind of message would you give?
Definitely. What I would say is get your screenings on time. So make that time for yourself. We know everybody's busy. We have work. We have family. You have to make that commitment to yourself. And for your family, you want to be around to be healthy. You want to be able to do the things that you want to do with your family. So with the mammograms, make sure at age 40, start getting them on a regular basis. Unless there's symptoms, you want to go earlier. And I'll talk to the gentleman, the colonoscopies for men and women, age 50, very important. Or earlier, family history, prostate screening, talk to your doctor about the importance of that. But I think also healthy lifestyle. So what can we do? We can eat healthier, reduce the red meats that we eat. We all love the red meats, but reduce the pork, the beef, lamb, those types, because they're looking at a link now between what we eat and cancer and other diseases. And exercise. And I know it's hard for me as well, but make that maybe 5-10 minutes, start building up 30 minutes a day to do that, to be able to have a healthier lifestyle. And of course, no smoking, so we know what we need to do. It's just that commitment, and we need to take that action.
Excellent. Any other parting messages?
Yes, one of the things, and these ladies had this is a beautiful program for the Hispanic community. And some people have asked me why hospice is with prevention of breast cancer. Well, in a way, we're all linked, in a way, right? Well, hospice, the way we're going to be working with these ladies is that we're going to talk about advanced directives. This is so important, and not only Hispanics, everybody should have something written down. Who is the person who's going to take care of decisions when a serious illness comes in place? And we have 5 Wishes and 5 Deseos, which is a beautiful booklet, and it becomes a living will. And what they're going to do, they're going to talk first of their program in these workshops, and then we're going to have just a little piece of it where we're going to explain to the Hispanic women and whoever is there why it's so important to have everything written down.
Absolutely.
Because you never know. It could be a car accident, it could be a heart attack. And if you don't have anything, okay, I would like my brother to take care of everything if I don't have that way of communicating because I lost consciousness, or hey, you have a life-limiting illness, there's going to be a point that you're not going to be able to talk or to address the family. So everything is going to be there. And one thing about the 5 Wishes and 5 Deseos booklet is that when you sign it, after you have put all your wishes there, I want my mom and dad to be with me. I want my dog to be with me close to my bed before I die, because that has happened. Yeah. That has happened. Anything. I would like to spread the ashes in Atlantic Ocean, or I would like to take the ashes with my my dog or whatever.
Right.
Things come like that. Families have these precious wishes that they have to be fulfilled. So when that booklet is signed, it becomes a legal document. So it's a living will.
It's very
see?
good.
So you can get these brochures, these booklets in our office in Winter Haven, which is 2590 Havendale Boulevard, and we're more than happy to give you, and it's free. The same we're going to do with the group of ladies that are going to be in Cuido. It's a free booklet. So if they want to have it, to keep it, and the good thing is that you can have it at home, but you can make copies of that booklet to take it to the hospital if something happens, to take it to your doctor, to give it to your loved ones. So you see, it's an important document.
Excellent. With the program, with Corner Hospice and Moffitt Cancer Center, and of course Cuido, how does one get involved? How do they find out information on where you're going to be meeting, who to get in contact with? Can you share a little bit of that with us?
We have a Facebook page. It says Cuido, and we also have a web page called www.josimecuido.com, and we have it in English, idotakecare.com. You could reach us through there, or you could reach us through the Moffitt Cancer Center. My phone number is 813-745-4972. If anyone's interested on having a Cuido workshop in their church or their women's group, we've done even the Alzheimer's Association support group. We did an event there. Totally open. Right now our Saturdays, I just want to let you know ahead of time, our Saturdays are booked through the end of February right now, and but we're open during the week.
Okay. Ladies, thank you so much for coming in.
Thank you.
Vanessa,
Thank you for having
Vivian,
us.
Jeanette, thank you so much. We really appreciate it, and
you.
such a terrific program.
Thank
you so much for having us here.
That's the Cuido program through the Moffitt Cancer Center, and of course partnering up with Cornerstone Hospice. What a terrific program. Ladies, get out there, get your screenings done. This is so vital to your health and your future. So to get in touch with these guys, like they said, you can contact Vivian at Cornerstone Hospice at 863-291-5560, or visit their website at www.cornerstonehospice.org. And you can contact the Moffitt Cancer Center for the Cuido program at 813-745-4972.